How are you? It's Natasha Mcpherson, owner of MedicareRocks.com and McPhersonInsurance.us. Today I'm honored to be able to make this video for you that will help you understand and navigate Medicare. The question I hear the most, which I'll simplify for you, is what the heck is Medicare and how does it work? I bet if you're watching this video, you've probably asked yourself the same question at some point, right? So today I'm going to break down Medicare in a simple and easy to understand way for you, and hopefully quickly enough. I would also love for you to have my Medicare enrollment plan checklist, which you can download complimentary by clicking the link that's with this video. I think you'll find the checklist beneficial as it provides you with a guided path to follow when enrolling in Medicare. If you have any questions, I'm always here to help you and answer any questions you have along the way. So let's get started. Who is exactly eligible for Medicare? You must be a U.S. citizen or a legal resident for at least 5 consecutive years and one of the following: age 65 or older, under 65 with a qualifying disability, or any person diagnosed with end-stage renal disease or ALS. What are the parts of Medicare? There are 5 parts of Medicare: Part A, Part B, Part C, Part D, and Medicare Supplement. I'll first start with what's called Original Medicare, which consists of Part A and Part B. Part A is what can be thought of as hospital insurance. It covers inpatient hospital care, inpatient mental health care, skilled nursing facility care, inpatient nursing home care that's not custodial long-term care, hospice care, and some blood transfusions. So what are the costs associated with Part A? Part A is premium free if you have worked 40 quarters, or else the deductible is $1,484 in 2021, which is the year I'm filming this video. It's also important to note that stays of more than 60 days have daily pays. You can utilize any hospital that accepts Medicare. However, hospital care outside of the U.S. usually isn't covered. On to Part B. Part B is what can be thought of as doctor and outpatient insurance, and it will cover physician services, outpatient hospital services, ambulance, outpatient mental health, laboratory services, durable medical equipment such as wheelchairs, oxygen, etc., outpatient physical, occupational, and speech language therapy, and some preventive care. The costs for Part B are no out-of-pocket maximum, and Part B monthly has a monthly premium, which is adjusted based on your income. And it's important to note that you may pay a higher premium if you sign up after your initial enrollment period. When I'm filming this video in 2021, the Part B deductible is currently $203. You'll pay 20% of approved Medicare costs, and Part B is accepted by physicians who accept Medicare. Together, Part A and B is called Original Medicare. However, you may notice some integral pieces to your healthcare missing, or certain questions arose while you were listening to that, such as Medicare Part A and Part B deductible, co-insurance and premiums, Medicare Part B excess charges, additional benefits such as hearing, vision, and dental, long-term care or custodial care, if that is the only care you need. Most nursing home care is considered custodial care, and prescription drug coverage. For prescription drug coverage, you'll need what we call Part D, which is also referred to as PDP, which is short for Prescription Drug Plan. This will help with the cost of prescription drugs. PDPs are only offered through private insurance companies, and the cost for a PDP varies from plan to plan. The medications covered also varies from plan to plan as well. This is what we call a formulary. A formulary is the list of drugs covered by an insurance plan. Many plans have tiered formularies. Generally, the lower tier, the lower the cost. This is why it's so important to work with a knowledgeable Medicare professional when choosing a PDP. Depending on your zip code, there could be hundreds of plans, and depending on what and how many medications you take, coordinating that alone can be very difficult compared to having a knowledgeable Medicare agent who knows the plans and has access to cutting-edge software that centralizes all the information like we do here in the office. It's important for me to make sure you're in a plan that covers most, if not all, of your medication, is within your financial needs, and continues to serve you. The benefits for a PDP can change year to year. As your personal Medicare professional, it's my job to check in with you to make sure you continue to be in the best plan for you each year. In a PDP, there are 4 coverage stages as of 2021 when this video is being made. Annual deductible, and not all plans have an annual deductible. Initial coverage, coverage gap, which is also referred to as a donut hole, and the final, which is catastrophic. The cost for these different stages change each year, so I'm hesitant to break it down in an in-depth video like this, but I'd love to walk you through it step by step over the phone or an email or text. You can reach out to me anytime. And by the way, don't forget, coverage is not automatic in a PDP, and penalties may incur if you enroll late. Moving on to Medicare Supplement. Medicare Supplement insurance, which is also referred to as MedSup, helps with some of the out-of-pocket costs not paid by original Medicare and are sold by private insurance companies. The premiums for a MedSup will vary based on plan and carrier. There are several plans, and plans are named A, B, C, D, E, F, G, H, I, J, K, L, M, N, high deductible F, and high deductible G. It's also important to point out that Massachusetts, Minnesota, and Wisconsin have different standardized plans than the other states. The benefits for Medicare supplement plans can also vary by plan and Medicare start date. To be eligible for a MedSup, you must be enrolled in Medicare Parts A and B, resident of the state in which you are applying for coverage, and age 65 or over. You can be under 65 in certain states. MedSup enrollment. Generally, the best time to enroll is during the 6-month open enrollment period following your 65th birthday or a Part B effective date because of the guaranteed issue rule. The Medicare Supplement Plan open enrollment lasts for 6 months and begins on the first day of the month in which you're both 65 or older and enrolled in Medicare Part B. There may be other situations in which your acceptance may be guaranteed. Now that you heard about original Medicare, maybe you aren't that impressed and you're thinking, well, do I have any other options? You may have heard about a Medicare Advantage plan. A Medicare Advantage plan combines both Medicare Part A and Part B and may also include prescription drug coverage. MA plans, Medicare Advantage, are offered by private insurance companies and often include additional benefits above and beyond original Medicare. To be eligible for an MA plan, you must have Medicare Parts A and B and live in an area that an MA plan serves. The plan premiums and benefits can change year to year, and it's important to know that you must continue to pay your Part B premiums while having an MA plan. Many MA plans include prescription drug coverage, and some even cover dental, vision, chiropractors, acupuncture, gym memberships, and much more. Depending on your MA plan, coverage can be limited to a service area unless it's an emergency, and you may be required to use a network of doctors and hospitals. The types of coordinated plans are Health Management Organization, HMO, Preferred Provider Organization, PPO, Special Needs Plan, S&P, Health Management Organization, Point of Service, HMO, POS, Private Fee for Service, PFFS, and Medicare Savings Account, MSA. Now that we've learned about the different parts of Medicare, what do you think is best for you? It's important to think ahead when planning for Medicare. Your health could change at any moment. Original Medicare offers flexibility, but would you be able to sustain a major health crisis if it were to occur? MA plans offer great benefits, but what if only an HMO is available in your area and you just so happen to come down with a rare disease of a specialist you'd like to see isn't in network? These are questions that a client had asked me, and it's really something to think about. When making Medicare decisions, it's important to look at the overall and the what ifs. It's not just about what's happening today or right now. When approaching Medicare planning, I use a specialized holistic approach that will help to remind you of outside factors when we're connecting and making decisions together. Some agents work on behalf of one plan only. I work for you and represent most plans in the area. It'd be my pleasure to sit down with you and figure out the best way to put it all together as a team. So before we end, when can you enroll in Medicare? The initial enrollment period would be 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. If you plan to continue to work during this time period, you may still enroll in Parts A and B. Usually I recommend my clients to enroll in Part A if they have 40 quarters. Why not? You've worked for it. You'll also want to talk to your HR department if your company has under 20 employees. You may have to enroll in Medicare completely, but talk to the benefits administrator first. During this time, make sure to keep all records of proof of your health insurance coverage. An issue may come up in the future and you may need these records. If you enroll in Medicare after you turn 65, you may be eligible for what we call a special enrollment period that may allow you to enroll in Medicare for up to 8 months after your employment or health insurance has ended, whichever comes first. You may also enroll in Medicare Advantage Plan or PDP 2 months after your employment or health insurance has ended. Whatever comes first. So remember this, if you go 63 days without prescription drug coverage, you will incur a lifetime penalty of 1% for every month you didn't have prescription drug coverage. So make sure to get that done. We don't want any fees. Here are some dates and circumstances you should keep in mind. Annual enrollment period for Medicare is October 15th through December 7th. Open enrollment period is January 1st through March 31st. During this time, you may change from one Medicare Advantage plan to another Medicare Advantage plan, or go back to original Medicare and a Part D plan. Special enrollment periods happen when moving into a new area, discontinuation of a plan, moving in or out of the skilled nursing care facility, and under certain circumstances if you have limited resources and or receive Medicaid. I hope you found this video insightful and were able to take something from it. Now would be a great time to review enrollment periods and ask questions. I'd love to hear from you and have a conversation to learn from each other. It'd be my pleasure to research your options, help you enroll, be your point of contact for your Medicare needs, and to schedule yearly reviews with you to ensure you're still in the best plan. My contact information is on the complimentary downloadable Medicare checklist and also with this video. Take care, and I hope to talk to you soon.